Hey everybody, what's going on? Gestalt Education back for another year. We're going to start this year off right with letting you save some money. So two of our favorite people are the Core 360 belt and Human Locomotion, which is Dr. Thomas Schaud. So don't forget, if you use the code Gestalt for the Core 360 belt, you get $5 off all belts except for the Ohm Track sensors. So Brett, what are some of the Schaud's favorite, some of your favorite Schaud gadgets?
Well, I mean, he's got a trunk full of gadgets, but I think my favorite one definitely would be we use the Toe Pro quite a bit. The Toe Pro, and then I think the Varus and Valgus Post have really given people like a nice option if they're not want to take that leap into like a customized orthotic to kind of a good option for the patient, but also to let them kind of like, bring the power back to the clinician to kind of decide where to post it. And so I think those are the two probably ones of Tom's stuff that I love. And of course, I can't get enough of his Human Locomotion. I mean, the book is still to this day pure insanity. So
beautiful. Yeah. Don't forget to use the code Gestalt on both those, the Core 360 belt and then also Human Locomotion. Links are in all of our podcasts. And we hope you guys like today's episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. We're still on our Florida swing, Brett. So we're it's
on
been
the home stretch.
It is. It's been a long 2 weeks. We just finished up with our Shacklock course with neurodynamics, and then we got DNS baseball coming in. So we've been home. We haven't been home for me 2 weeks at this point.
It feels like forever, honestly.
So we'll be excited to get back to Troy and start seeing some patients. But before we left Florida, we had to sit down with one of your good old friends, Chris Tohtz. And so Chris is a chiropractor. She's also an acupuncture extraordinaire. And she's trained in China for traditional acupuncture. You just got a new appointment with the VA for doing acupuncture, which is a really cool thing. I'm sure we'll get into that. But along with acupuncture, you're also utilizing MDT. You're also a Cert MDT along with Brett and I. And so today is going to be a lot about integration. But before we get into it, we got to shout out our good friends Arkenstone. Brett picked up this baby from Total Wine last night.
Now you can get it at Total Wine.
Exactly.
It's insane, yeah.
That is crazy. Great surprise when he walked over with that bottle.
Oh gosh, it was like Christmas morning.
It literally was. So anyway, Brett, you when did you first run into Chris?
It had to be at National. I don't know exactly, because you and Tom were close, and I would think it would be somewhere along those lines 20 years ago, I would think.
Probably. I think it was probably something similar to that. I mean, I remember, I think it might have either been at classes at National or it could have been at the clinic, which is also a possibility.
Yeah.
Because, so I was working with Tom, which was a friend of Brett's, and he was like, oh, Brett, you got to meet Brett, blah, blah, blah. Then I met you and I was like, oh, he's a real person. Like for a second, I thought you were like Snuffleupagus.
Yeah. Well, I mean, your background is so insane. I think like where you are very unique. I mean, in a world where people think there's not much evidence and things like that, you've really, you put your flag in the ground in acupuncture. And, in our world, the people that are listening, typically we're all trained in dry needling. All you ever hear about dry needling. And it's almost like, and I told Taylor this, it's like, I know there's something to traditional Chinese acupuncture in our world. We just haven't had the right person to kind of tell us what that is. So I think I'm real excited for the next 60 minutes or so to kind of hear like what your thoughts are. I mean, maybe our first jump off point is what is traditional Chinese acupuncture? How is that different than dry needling? And the point that I want to be sure that we get to is the people who are doing dry needling and not doing traditional Chinese acupuncture, what are we missing?
Sure. So they're definitely very different systems. I know that, right, there's a turf war. We all understand that there's a turf war out there about dry needling and acupuncture, but they're definitely very different systems. They utilize the same tool, right? It's a solid filiform needle that they both use, but the thought process is the dry needling people will tell you that they are working on trigger points or ashi points and tender points, but they also work on motor points. This, to me, is something that the acupuncture world, they get the ashi points and the tender points. They understand the trigger points, but they really don't understand the utility of the motor point. So traditional acupuncture on the flip side of that, right? So we talk about, right, a lot in dry needling where we're, it's not just that local stimulation and the neurological feedback, but the release of endorphins and enkephalins and sort of changing that inflammatory cascade, right? traditional TCM or traditional Chinese medicine works on that, but they look at it more from a system of balancing out the energy, the qi, the blood, and the fluids in the body. So there's actually studies now where they're fluoroscopically finding out that the meridians do exist and that they are real. So the question is, a lot of this theory that we have to study when we do acupuncture, a lot of the things that we couldn't explain from science before, I just find it really intriguing that a lot of these Taoist priests and a lot of these acupuncturists had figured a lot of this out before dissection and before all the neuroanatomy and everything else. Like they had all of the organs figured out where they were pre-dissection. So how does that happen?
Right. Right.
So there's definitely something more to it than just, poking in a needle and getting a reflex arc.
Right. Well, I think we always say to our patients too, I mean, the Chinese have been using needles for therapy for
5,000 years, basically.
6,000,
yeah.
Maybe even more, years. And so how over time, I guess, if those points change, did they get them all right away? Or,
No, it's so great you asked that. So, I've studied in China twice. And while I was there, it's really interesting to download apps on your phone. Well, when I did an update, I lost some atlases that I got in China that I can't get back here. And I was like, ugh. But I was reading in one of my clinics, and a lot of the instructors that are there will tell you that they don't speak English and you come with an interpreter. And I'm pronouncing things with my bad Chinese. Yeah. And this guy turns around, speaks to me in English, and he goes, you know what that point is? Blah, 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 blah. Like there's some ancient Chinese secret stuff that they don't let out of the country. So what we do learn here, it's about 85% good, but there's definitely some stuff that gets a little bit watered down. Sure. But no, there's a consortium that meets every 3 to 5 years to determine the exact location of the standard 361 acupuncture points to make sure that we are actually finding them where they're supposed to be, which I think is intriguing.
Well, and I mean, you kind of were peacocking this book around here before we started, and this came from China, right?
It did. Yeah, I bought that scalp acupuncture book in China.
So, I mean, do you think, like in our world, scalp acupuncture, is that potentially helping us with like chronic pain?
Very much so.
Allowing us to numb down the pain, if you will. I mean, is that where like people who are in the rehab musculoskeletal world, is that how we'd be using scalp acupuncture? Or is there more to it than that?
Well, and I think that so scalp acupuncture, just like Korean hand acupuncture or auriculotherapy where we're using the ear, these are all part of like microsystem acupuncture. You can't do those when you dry needle. Right? Dry needling is in that muscle. Sure. And it's only in that spot, right? So when we're talking microsystems, this is one of the bonuses for us as chiropractors that are doing acupuncture as well, because then we've got this capability to pull out a system. And so I used to work at the pain clinic at Stroger Hospital back in Chicago when I lived there. And we used to use a lot of microsystems because people don't have to disrobe. I've got a hand, I've got an ear, I've got a head, right? So we don't have to worry about taking off clothes. We don't have to worry about any of that. But potent in like the reprogramming of pain patterns, which was really interesting. So when we would do scalp acupuncture, we would needle along the calvarium of the skull. And then we have to, and I'm like, all right, let's go reprogram that. Let's go for a walk. So we're taking people with their canes and their walkers and stuff like that. And they're making a couple passes and we're stimulating that point in the head. And you're watching them like, can I put the cane aside? And they're just walking. Like it was, I'm like, here's the magic of acupuncture, why I studied acupuncture. But it'd be amazing. And then sometimes, we can teach them how to stimulate those points, but we need to bring them back to continue that reprogramming of the nervous system.
I think too, people in our world, we struggle with just talking about scalp acupuncture. What would the difference be between you studying this and knowing the exact places to put the needles versus me just saying, screw it, I'm not going to read this, but I'm just going to pull out 100 needles and put them all over your scalp? What would in your opinion, what's the difference?
So have you guys ever over-therapied somebody? I mean, I do this
like
on the rec.
Every day.
Yeah, I do this on the rec. Okay, I'm glad I'm not the only person where people get up and they look a little drunk and they're kind of vasovagal and you're like, oh, too much today. Yeah. Great.
Note to self.
Yeah, note to self. That's the issue, right? If you end up like just non-judiciously throwing needles at things, you end up over-therapying people. And I think it's just too much bombardment to the nervous system.
But do you think, oh, sorry.
Go ahead. No, you got it.
No, I was just going to ask you, so how important, even like if we're talking about meridians throughout the body, if I'm talking here versus here, you got a little critter there.
Yeah, gives spreads.
What's
So when we teach traditional points, right, we teach sun measurements, and it's a measurement that we use off the hand or relationships off the body. But then there's the palpation aspect of it, right? So like, give me your arm. So if I'm working on you and we're working on the large intestine meridian, which traditionally runs here, I'm going to come along to like, there's your large intestine 10. You can feel the holes. So although this might not be too sun below the other point, I'm going to go via palpation for those points. And I think, you know, as you get deeper into acupuncture, to me, that's how that's supposed to be. Mm-hmm. So sometimes, like when I'm given tests, the students will get smart with me and I'll be like, is that really where that point is? And they're like, feel the hole. And I was like, where's it supposed to be? And they're like, here. And I'm like, fine. Right. So like, fine. Because they're actually palpating. Right. And I would much rather people feel than understand the theory. I mean, I've seen there's acupuncture classes, and this is a big sticky point for me. There's acupuncture classes where you can take all 100 hours for a 100-hour certification to sit for NBCE, or in some states, completely online.
Oh, wow.
And how do you do a manual skill when you've never put a needle in someone?
Right.
I mean, I think that's a disservice to the public. They're a danger to themselves and other people. Mm-hmm. And so, you know, I mean, it's problematic, but they know their theory real well.
Right.
Right. But it's not helpful.
Well, I mean, I think that's another turf war, if I'm correct, where I took the 100 hours. I passed the board. Yep. So, and I mean, to be quite honest, it was a little bit of a pain in the butt. You know, like I remember I was actually teaching a national, mm-hmm. and I got my weekends crossed up. So before I started teaching at national, I had to go take this board, which I wasn't, you know, I was fine, but I didn't get ready for it like I should have. Mm-hmm. But anyways. But
you passed.
I passed. Oh, okay. Yeah. Crushed it. But like, so what do you think about, because the traditional Chinese acupuncturists don't actually love the chiropractor
doing needling.
So, or like even the ones who are trained like I am. I mean, I'm board certified to do it, but there's another turf war there too, right? Like
there is. So the fun part that you need to know, Brett, is, and I was so close. So in 2000, the NCC-AOM, which is the national accrediting body for acupuncture and oriental medicine, stopped chiropractors with 300 hours of training getting their LAC.
Right.
So I was 40 hours short, and I graduated in 2001. So I also wasn't a doctor. So 2 reasons I could not sit. So I had to wait, and I went back to school to get my separate license. So that's like, you want to talk about a love of the medicine. You know, that was me as an adult having a business, which practically crippled my business, going back to school to get my separate license in acupuncture because my husband has a job. There's some states, there's 18 states that you still can't do acupuncture under your chiro license. So we used to be able to sit for it. So sometimes when you see some of the old timers in our profession that have a dual degree, that's how they got it. Mm-hmm. They didn't go to separate school.
And are they better off for having that? Like, do you feel like the training's that much different?
So it depends. Like, so I end up teaching a lot of continuing education, right, for acupuncture.
Yeah, you're everywhere. Literally.
And I find that people don't know their theory. They're running on these patterns that they learned of, you know, poking people for, you know, these bladder 23 and bladder 25 for low back pain, right? Large intestine 4 and large intestine 20 for a nasal congestion, right? So they're using these typical patterns that they know, but they don't know why they're doing them. So when I'm asking them the questions for their theory and they're looking at me like, who's the crazy lady that's all animated and waving her arms up front, right? I'm like, well, you guys need to know your theory a little bit better. And so they're running on these patterns. So are they better off for it? I don't know. I mean, I will say this much. In a comparison back and forth between acupuncture education and chiropractic education, the only thing we're really missing is about 200 hours of supervised clinical time.
Okay.
Because when you hour to hour compare, if you do like a diplomate, like a 300-hour diplomate, and you hour to hour compare those, it's just supervised time. So we were trying to work really hard with the ASA, which is the American Society of Acupuncture, to be like, hey, if we put together like a clinical internship where y'all watched us for like 200 hours, could we sit for our LAC if we want it? Right. And then it transfers. Because like the joke is like I was looking at potentially moving to Europe. My chiropractic degree in many countries over there doesn't matter, but my acupuncture master's did.
Wow.
And I was like, this is so sad for me.
That is.
Yeah, no joke.
But that's why I went back, because acupuncture is so entrenched in my practice that, you know, if I was going to end up moving to an area where I couldn't do it, I knew I needed a separate license.
So I remember when I was sitting through it, and I always say about myself.
Who'd you study with, by the way?
I'm trying to think who taught maybe.
Were you at Logan? Would you study with Zev Meyerowitz?
No.
Yenny
or
Yenny? Yeah.
Yenny.
Yeah, Richard Yenny.
Yeah. But like, so they're telling
Yenny
the story
of
but like wind, fire, like all this stuff that was really, because I was the most orthopedic person in my class, medical. Now I'm like the biggest hippie in my class probably, but I mean at that point,
welcome to the dark side.
But like, do you buy into that whole when the wind, the fire, all that stuff? I mean, is that all something that you are bought into, or is that like, is it more like something like the chiropractic philosophy? Like we all kind of want to learn it, and it's like it's part of our heritage and our history,
right.
But that we all know that's not exactly how it is.
Well, we know it's not exactly how it is, but it does fill in. This may be slightly controversial, much like religion. It fills in the gaps that we can't yet explain.
Right.
Okay.
Fair.
So, and I think a little bit of some of the chiropractic philosophy turns around and does that. Like, how pathetic do you think it is that when babies have reflux now, what are doctors doing? Chapman reflex points to diagnose them with reflux. And I'm like, that's our stuff. Right.
Right.
And that's their test. That's it. And then they give them PPIs, which is a disservice to small children, but that's another topic for a different day. At any rate, but there's something to that. Do I buy into the TCM philosophy? Yes, it does have some understanding for some things that I can greatly appreciate. The thing that I find even more intriguing is when you look at that from an herbal perspective. So like if you ever turn around and like let's say, fine example, like let's say collard greens, right? You guys eat collard greens?
Sure.
Yeah. Okay, good. Yeah. Eat them Brazilian style. They're way better and they're much healthier for you because we just thin slice them and saute them in olive oil and garlic. They're way tastier. Yeah. But anyway, turn bright green, very nice. But when you taste them, like you taste that bitter, right? Mm-hmm. What do bitter herbs do in Western medicine? What do the greens do, right? Well, they're high in antioxidants, they're high in B vitamins, they're going to purge stuff out and they help your liver metabolize and get junk out, right? Mm-hmm. In Chinese medicine, they clear heat. That's the same thing. So the question is, are we all looking at the same thing, but from a different side of that lens? It's the joke of like, if 5 blind people are feeling an elephant and they're trying to describe what it is, right? And somebody grabs the trunk and they're like, oh, it's like thin and it's flexible. And somebody's got the leg. They're like, no, it's thick and it's leathery, right? Somebody else grabs the tail. We're all looking at the same thing, but from a different lens.
Mm-hmm. Do you think though, if you took a class of 100 chiropractic students, is it fair to say that 5 will go all in acupuncture and maybe not even 5 out of 100 or?
Oh yeah. 3 to 5.
So do you think it's because though, like there's this story that's hard for people to kind of wrap their brain around?
It's a totally different language, right? So when I teach my first class, I watch the eyes glaze over all the time because we start talking about the organs and what they do. And I was like, look, this is presently a game of Tetris for you. We're stacking up your Tetris pieces. And all of a sudden you're going to go, oh, no, it all makes sense, right? As you get a little bit more stuff under your belt. But yeah, it is. It's a language. And then there's translation issues that come out of translating the Chinese terms into pinyin, into English, because then you can look at like, well, what is this called? Is it acquired chi? Is it your foundation of your ladder heaven? Like, what do we call this? We're all saying the same thing, but it's who translated your book. So it's learning a new language and it's learning a new system. So yeah, a lot of people bail on it.
And your naysayers would say, well, what about the power of suggestion? Like if I say, hey, Chris, you are going to quit smoking when I put this needle in your ear, is it the needle in your ear that's done this, or is it I have like really used a placebo on my side, which we're using placebos all the time.
Correct. I was like, I'm all for placebo.
Yeah. Oh yeah. The most powerful drug of all time.
It is the most powerful drug of all time. And you know what? If that's what I'm getting when I'm putting, and I've had people too, when you do scalp acupuncture, or sometimes you do the ear, they're like, ooh, my ear's hot. Mm-hmm. I'm like, well, what did I just stomp on your foot? And I was like, you won't feel your back pain at all anymore, right? But it's the question of, is it a counter irritant? Right. I mean, is it enough that's what's happening?
Like
sure, maybe.
Break the cycle. Yeah. So then what about let's say, give us two answers. A patient asks you, hey, you stuck needles in my scalp and my back pain feels so much better. How are you explaining that to maybe a patient for a layman's term? And then how are you explaining it to a student on what's your, you don't have to have any research or anything like that, but what's your actual idea on the mechanism of how it works?
Sure. Well, I just tell them, I was like, look, you know that there's a map in your brain. It's called your homunculus, right? So a lot of people know what that is. And I was like, well, there's a map on your head that corresponds to every part of your body. And if we can stimulate that part of the body and we can break the cycle of what it's interpreting as normal, then we can move forward with that. And then they're like, oh, okay. Like they're kind of on board with it. What do I say to students? And I was like, oh, it depends on whose system you're looking at. Because if you look in there, all those maps, they're totally different. So then the question remains, if one system doesn't work, do you jump over into another system? Do you change scalp systems? Do you start going to the ear? Do you go to the French ear or not, the Noget system in the ear, where when it's chronic, the somatopic map flips in the ear? Like, what do you go for?
Right.
So sometimes, like, I have a little impedance tester, and I'll check for electrical conductivity in the ear, and I'm like, oh, no, that's not it. And I'll come down here, and I'll flip the map, and I was like, that's where we need to poke them. Because it'll register. Instead of it singing high, it'll go low.
And then what is the depth of acupuncture that you use throughout the body? I mean, are we just going into the epidermis? Are we going, 8 inches deep? You hear these crazy stories in China. It's like,
yeah.
I was like, and it's anesthetic and
very much so. I watched some really disgusting things in China. I won't lie to you, of like what really looked like 18 gauge needles, right? So your blood draw needles being used 5 inches into the back for somebody with chronic back pain. But then the question is, how is it any worse than an epidural, an ESI, an epidural steroid injection?
Right.
Right? Like, that's what they're using.
Right.
Right? So then the question is it the needle or is it the steroid?
Right.
Right? I mean, Trevell & Simons has that question forever, right? So, so what you need to know about the chi systems, or the energy, the channels in the collaterals, they call them the Luo Mai, is that they run superficially on the body, but circumferentially in toward the center. So sometimes you want to get in to access those deeper layers. So you need to needle deeper. So I studied with Sunderledge. Yenny and Sunderledge came up together. So I studied with Sunderledge, and Sunderledge was all about these patterns of health and wellness, right? So I still teach them, but we've changed them up a little bit. And he was inserting 5-inch needles into everyone's behind. And his whole take was he would come over during your final exam and he would touch that needle. And if it didn't thunk the bone, you didn't have it in deep enough.
Well, that makes it easy. I mean,
yeah. And I was like, okay, but if you've got somebody on the table and they're sensitive to that, right? Like you can tap it in. I never tell people when I'm deep needling ever. I was like, you might feel a little more pressure, because if you take it out and they're like, that was a lot of pressure. They're like, can you tell me, like, were you using a different needle? Yeah, I was using a different needle. I'm like, do you want to see it? And they're like, yeah, I want to see it. And they're like, oh, and then they're like losing their mind because you're showing them like you put something like this far into their behind. And I was like, you got enough junk in your tree.
Is there like a home base? I mean, like if you come to, DNS and neural rehabilitation, you're probably never going to go wrong if you start with changing someone's respiration, intra-abdominal pressure.
All day.
What is that for traditional Chinese acupuncture? Like what would you not be wrong for doing on every patient, would you say?
Oh, wow. That's a really great question. So I know it sounds really weird, but I teach people, it's like breathing and healing sounds. It's Qigong. It's the same thing. So you're talking about DNS and changing breathing. You can teach people to manipulate their own qi and their own energy by using different sounds or different breathing techniques. And so like a big one that I always give people is for the liver, because the liver is like anger and unfulfilled desires. Yep. See those in Chinese medicine. This is liver qi stagnation. So I always make jokes. I was like, I will never,
you need that.
I will never Botox this because right. A, I won't, but B, I was like, I want people to know I'm mad when I'm mad.
You need collard greens.
That's right.
Acupuncture right here. We could acupuncture that for you.
All right. Please God.
But, so when we see stuff like that, like I've given this to little kids. Because, I treat the little people that I think they're hilarious. And so I've given this to little kids that have like, little rage issues and stuff like that. So we'll give them the healing sound for the liver, which is like, shh, which is really funny. You do it in your car when you're mad. You do it. It automatically happens. And I was like, oh. So then again, you're like,
do this in my car now?
Still makes you feel better. Still makes you feel better. Yeah, I mean, I'm more than happy you telling people they're number one.
Yeah, exactly.
But yeah, so I mean, I'll give people Qigong, I'll give them breathing. It's always the safest thing that you can do for people. So if people are on blood thinners or they have really thin or fragile skin, and you're not worried about pricking them with a needle, right? That's always safe to do. And I am of the philosophy of less is more. The more you understand the point energetics of your points, the less needles you can use to be safe and effective.
Well, there's an old saying in like the sniper approach that like the master acupuncturist only needs one needle.
Yeah.
I mean, come
it's
on,
like Kiss of the Dragon, right? Yeah, no.
That's like in our world. Oh, I adjusted their proximal tip fib joint and fixed
everything is better. Yeah.
Yeah. So I mean, so
it's
that's not really
HIO.
true. I mean, like, is there a little bit? No, there's some smoke and mirrors.
There's well, I will say that like you can do some pretty strong, powerful stuff with the ear because there's a couple points that you can put in the ear and they can make some pretty profound effects. Battlefield is 5 points in one ear. And, Richard Nimsow has been using this. It's a medical thing that they've taught for vets. And they do it in the system. Why? Because they can take off their helmet. It's the one thing that we can expose, right? Came up with the system and it's great.
And then, I mean, are you using like traditional needles for auricular therapy or what?
I like to use these really horrible needles called ASP needles. Did you guys ever use them in your training? Oh, okay. So ASPs come in, they come in 3 different kinds. There's what's called a classic, and those are silver. Silver sedates in Chinese medicine, right? There's titanium, which is amphoteric. So it'll stimulate or sedate. And then there's gold. So most of what I input is they're gold-plated needles. Oh, wow. So they stimulate. And so I have a tester and I'll hold people's pulse and I'll test to see what balances out the pulse better, the gold or the silver. And then we'll pick as need be. We'll start poking them in and then we can retest the pulse and then we'll make them move. We'll see how they're doing. And we'll put those in there, but we make jokes and call them darts. They're obviously much smaller than my ear ring that's up here. They look like little tiny flat balls, but they're shaped like this and like this. So they stay in for about 6 or 8 days. Okay. Wow. They bite when they go in. So if you've ever gotten your ear pierced, it feels a little like that. Okay. But they stay in. And so then it gives people like, I have a woman that could only come in and see me. She was an Orthodox Jewish woman and she could only come in and see me on specific days. And she could never see me Friday. It's not like winter was rough, right? Because it was like 3:00. Like she ain't coming to see me on Friday, because she's got to go. And so we would put, she had chronic bronchitis and we fixed up some stuff with her diet, but we would acupuncture her. And I got to the point where I could acupuncture her once every 4 to 6 weeks and she would stay well, even through cold and flu season. She wasn't getting sick. And so, we would ASP her ears and she was able to keep them in. She was real gentle with them and she could keep them in her ear.
You mentioned something about diet there. So you've also been trained in functional medicine. And so how often are you using acupuncture assessment to drive change in, say, dietary changes or supplementation or anything like that? Do you combine those two worlds in that manner?
I have. I've also messed things up in that manner, which is really great. So like I had a patient come in and he had elevated cholesterol and he also in Chinese medicine had what they call gallbladder and liver heat and yang rising. So it'd be like kind of ragey and stuff like that. And I was like, we're going to give you some, essential fats and some Google extract and a couple of different things to like, drive your cholesterol down. And he came in 3 days later and here's quiz time. You ready? What's the color of the liver?
What's the color? Green.
Green. He came in and was visibly green. And I looked at him. I'm like, you doing okay? And he's like, I don't know. I'm like, I'm a little nauseous. And he's like, I don't really feel good. And I was like, just start the supplements. And he was like, yeah. He's like, but they're natural. They won't do that. I was like, fallacy. I was like, okay, number one. I was like, dude, not for you. And I turned around and I changed it up and I gave him a Chinese herbal formula to drop his cholesterol down, which was all things to remove like phlegm and heat and stuff like that. And it dropped it down. So this is where all of a sudden sometimes like you can get it wrong. And I was like, we needed to lean more into the TCM for you because you do better with that than you were doing with some other stuff. Say on the same flip side, like I have women that come in a lot for fertility. So I end up doing a lot of fertility consults. And these women, they're like the fertility docs are drowning them in DHEA, but they're not going back and checking their DHEA.
Right.
And I'm like, it's a hormone. Like, we need to make sure that it's not too high, it's not too low. I would like that Goldilocks number of having it in the middle, blah, blah, blah. And then, then they're like, I want to do all the acupuncture and the Chinese herbs. Because the hard part with the fertility ladies is, right, you could be like, I would like you to go stand in the corner and sing Happy Birthday facing east. And they would be like, how many times a day and in what key? Yeah, exactly. Right? They will kind of do anything.
And their husbands will be there patting their back.
Yeah. But I was like, can you please stop drinking wine and vaping? And they're like, no.
I want to get pregnant.
Yeah, I'd be like, it's okay. We'll make millions of them. We only need one good one. But so, it's the hard part that I find that a lot of times they end up getting preyed upon by people that don't necessarily know what they're doing really well. I mean, there's a whole separate acupuncture board for people that are doing fertility.
Right.
Yeah.
Right. What about electroacupuncture? That's the thing?
I do it. Yeah, I do it more so. Well, I'll do it like sometimes if you do traditional pulse diagnosis, right? And this makes me a little angry because so in the chiropractic world, right? What do we do? Mm-hmm. We palpate, right? Mm-hmm. Why shouldn't we learn pulse diagnosis?
Mm. Right.
We feel real well. Mm-hmm. Nobody can teach it. Mm. And so I find a lot of people rely on EDX, electrodiagnosis. And I was like, can we please stop doing that? Let's feel the pulse. And so I teach pulse diagnosis because I think it's important. Now there's like 32 different pulses. Can I feel them all? Can I identify them all? No. Mm-hmm. But I got about 18 of them that I'm real good at.
Sure.
Okay.
Right.
So I'll teach what I know. And I'll be like, look, there's masters that do this. This is all they do. It'll be like 5 minutes feeling a pulse. I also don't have that level of time. But so I'll take pulse and I'll kind of see what's going on. If I have somebody whose pulse is really, really low, which means they're deficient, you go put too many needles in them, you're going to make them vasovagal and they'll feel worse. Mm-hmm. I need to dump some energy into the system. So I'll hook them up to electroacupuncture. Mm-hmm. I'll also do it for people with pain syndromes if we need to break the pain cycle because that works. And then I have a thing called a pointer plus when I do dry needling that I will put in and I create their ground. And then I want to potentiate that muscle on muscles that are trigger pointed and inhibited to wake it up and then rehab them.
Sure.
Right. Can you tell us, like in the dry needling world, like the people who were trained under Ma, which I was originally trained in dry needling from Ma.
He didn't call it dry needling when we first learned it. You remember that, right? It was called biomedical acupuncture.
Yeah, that's
for
right.
pain. Mm-hmm.
Yeah. But the thought was it didn't matter how long you left the needle in. But one of our previous guests last month was Mark Scapitici from Toronto. And he said a couple interesting things. He said, one, he hasn't been using electroacupuncture, which, originally he had used a bunch of. Mm-hmm. But the other thing he was saying that he's found a lot of benefit from leaving the needles in for periods of time. So how important is that to you? How do you decide how long to leave the needles in? Is every patient different? Can you just kind of speak on that?
Yeah, sure. Every patient is a little different. I mean, for acupuncture, I will typically leave people's needles in for 20, 25 minutes. Now, will I acupuncture and dry needle in the same session? Yes. So sometimes I'll pin up constitutional points for what I'm trying to work on. And then if they have a pain syndrome or something along that line, then I'll dry needle it, stimulate it with the pointer plus, pull those needles, and then leave them sit on their needles for a while. There's something very parasympathetic about being on acupuncture. It definitely calms the system down. And we're so much in a sympathetic society, right? Everything's go, 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 now.
You can't have your phone for 20 minutes. There's probably...
It's a dark room, yeah.
How many people...
die with that?
Well,
ask if they can have their phone.
Yes,
yeah.
They want their phone.
Oh, yeah, that's right.
And I was like, no, this is your 20-minute respite that you have to relax. And I was like, and don't make me come in here and take it. I feel like somebody's mom. But it's really the case. Or I'll come in and that, you should have put yin tong in somebody because they're like, okay, so I've been laying here and I thought about these 20 questions I have for you. When you come in, and I was like, let me just stimulate that a little more. Go home.
Right.
But yeah, so it just depends person to person. That one lady that I talked to you about that she was my Orthodox patient that could only come in. I would leave her on. I would see her as my third to last person, and I'd pin her up and leave her for an hour.
Wow.
I'd just leave her on the table and come back.
She loved it, I'm sure.
She did. Yeah. Well, and what we found was that if I left her for 40 minutes, we tried 20, that didn't work. We tried 30, 40, and she needed to come back in. She was starting to get wheezy and stuff. When I started treating her for an hour, the wheezing stayed away.
And are you going for this serene experience while you're, are you hitting the lights down? There's music going,
Yeah, I have alpha wave music on, which is your pre-meditative music. So I'll have alpha wave music on in the room. There's usually some type of noisemaker. I try really hard not to schedule my acupuncture patients around my little kids.
Yeah. You're screaming next door.
They're yelling and screaming. Yeah. Exactly. And having a lovely time. It's a darker room. So I have dimmers in my rooms. Yeah.
Moxibustion.
Oh, I love Moxa.
You use it? Yeah.
Oh, yes.
Yeah.
Yeah, I use the real deal. And I will say I finally found an air filter that sucks the horrible out of the room. Because, I don't mind the smell, but I also, there's nothing better than coming home and doing a bunch of work with like mentholated cream and then burning moxa, and you come home and you smell like minty weed.
Right.
Yeah,
exactly.
And then you get the cops pull you over on the way home on the Dan Ryan, and you're like, oh, great.
I
Hi,
promise.
officer. Swear I'm not stoned. Yeah. And now weed's legal in Chicago. So, yeah.
Beautiful.
Okay, so you're trained in McKinsey. Can you, if someone comes in with, we classify them as a derangement, they're obviously in a lot of discomfort. Maybe they have a directional preference, maybe they don't. Like in our world, can you just give us an example of what that would look like? What are the points that you like? What would be, just so like people can take something away from like, what you would, how you'd be implementing those two systems together.
Sure. So, I use, if I have somebody that comes in with musculoskeletal pain, I do like to use McKenzie's system. The one thing that I appreciate about that is trying to find, if anything, it teaches them what they shouldn't do. Right. All day, every day. So, and I'm a big fan of like, well, let's make you worse, because it's really going to teach you like what you should not be doing.
Yeah.
At least for now. Right. Not forever. And that's, the one thing you have to explain to them. But, hoping to find that directional preference. Sometimes people are afraid to move, because they've hurt themselves in specific positions. Sometimes doing the acupuncture to get it to calm down will let them start to get into that movement where we can find a directional preference if they're not an other. Right. Whereas, and then sometimes I get people that just can't, you're giving them overpressure. And I was like, I know you're not going to be able to do overpressure at home. Well, what if we relax the tissue? Okay. So then maybe like my patient yesterday, he golfs a lot, is down here, he hurt his back. He was definite derangement, just an extension responder, but he has trouble getting into extension. His tissue is super dehydrated, like, and I was like, all right, number one, you need to drink more water. I was like, but number two, I was like, let's get in on this, right? So we needle him a whole bunch, and then he could get into that extension without overpressure. So sometimes it's going to release the tissue and release the fascia enough that we can start to get them to move a little bit better.
And a lot of people in acupuncture, they talk about like actually being able to palpate tissue, like with the needle going in it. Yeah.
You can. Can you feel it?
Yeah, you can. I would like for you to comment on like, what are we feeling? I'm sure you're on a crusade or journey like we are in the world of like
what is going on,
palpating joints and soft tissues. And so, as you've done this for almost 20 years, like when the needle's going in, what are some of the things that you're noticing and feeling, like the feedback from the needle?
Oh, very much. So different layers of things, right? You can immediately tell if somebody's dehydrated, right? All day, every day. You get those adhesions in the fascia that's superficial. You go to tap the needle in and it's like pushing it through leather.
Yeah.
Right?
That means dehydration.
That's dehydration and or fascial adhesions. The other people that I feel that with is my best analogy for this. I like to talk about food a lot. And I cook. So, your patients that have like fibro and they have those superficial fascial adhesions, but underneath it, they feel all gummy.
Yeah. Mushy.
Yeah. So like that, you used to go to put it in, it's hard to get in, and then it just sinks and it falls in like butter. Yeah. Like melty butter. You're like, oh,
ooh, gross.
You're like, you're like, that's fibro. Right. And you're kind of half diagnosing with the needle. What other fun things? I've had times where like, look at the needle when it's in. So this is a Chinese concept. If you see this tenting around the needle, that's an excess in the area, like sparrow peck it or guide it up and down to get it to where it'll lay flat. If you see it as a big deficiency and it forms a big hole, that's a deficiency. So you want to be able to bring that chi up to the surface, needle in deeper, and then pull it up a little bit. They call that lifting. So there's lift and there's thrust, and that's called lifting. So then lift it a little bit, and then the patients will usually leave and they'll be like, oh, I feel better.
What do you think about, I've heard all kinds of different theories on this, but I'm dying to ask you this question. Some people, you're needling them or you're doing acupuncture with them, whatever you want to call it, and you're getting this huge sympathetic response. Like there's redness around the needles. What does that tell you about that case? What does that actually mean? So
and it's funny because where do you usually find it? You have it in a couple places, right? Sometimes you can see it in the upper back or the chest or in the upper back. Yeah. But a lot of times, like sometimes you'll see it in people in their legs. Like if you're working down in their legs, I don't get it as often in there. So in Chinese medicine, heat rises. So this is why you get the release of the heat more up here. So that thought process with that's release of heat. It's also called, you'll love this, xie qi, which is evil chi. It's some disruption of the
That makes
chi.
sense.
Yeah.
Think about those patients. That makes
right?
sense.
You're like, that makes total sense. But the thought process is that you leave it in there until the redness goes away because you want that pathogen to escape and leak out. Okay. From a Western medicine standpoint, and I was like, what's up with the eosinophil reaction and what is inflaming you? Now, I have had patients that, right, like DBC, is it DBC? Yeah, it's DBC and sarin. Both of them have silicone coating on their tip. If you have patients that have like nickel allergies or are sensitive to metals, you can use those needles. If you use other needles, sometimes they'll hive up. And I've had that happen with a couple of patients where I'm like, are you allergic to metals? You know, because they'll get these huge hives. Chinese medicine, that's like dampened wind in the system. So then you have to like look at your philosophy and be like, do you fit that pathway? And if you don't, I'm going to pop back to Western medicine and be like, nope. Something is this parasitic? Is it allergy? What is it? Do you have mast cell activating syndrome? Like, what's the deal?
Right. What, it's kind of interesting to me because like I feel like people think that the people in the dry
all over the place. Sorry.
No, you're good. This is great.
That like the dry needling is the more evidence based, but the irony to me is like if you look at like Mass General or Mayo or some of these Kaiser, like some of these top hospital systems, they're more clamoring for the traditional Chinese acupuncture. So, like in a world that's so evidence-based, you kind of think they'd be wanting the dry needling, but they're actually not. They're wanting
dry needling is a one-trick pony. That's why. Okay. So like dry needling is great for musculoskeletal system stuff.
Right.
Done. Right. Whereas acupuncture, right, we can start to get in the stroke rehab, Alzheimer's neurological stuff. It helps support fertility in pregnant women. Right. So we can start to go into that pathway a little bit more. Right. So I think that's why they want that. Now, on the flip side, I love to see acupuncturists study dry needling. And there's so many of them sometimes they're like, and I was like, look, you can study with Whitfield Reeves and you can study with a lot. Matt Callison is an LAC and a PT. I love his motor point index. It's amazing. But, unless you study with those people and, I might get ostracized by my own, I don't find that general acupuncturists are real good at MSK.
Right. No, I would agree with that probably.
Yeah.
What about going back to the mechanism a little bit? Do you do fascial winding? Are you twisting? Do you buy into that model? Do you think?
So I studied with a woman that does. Yeah. So every year the CCA, the Chiropractic Council of Acupuncture, has an annual symposium, and we bring different people in to study with different people, right? You learn different stuff from different folks. This woman, Ann Cecile Sturman, came in, and she works on what's called the sinew channels. And she would take the needles, and she would wind it and pull and wind it and pull and wind it until it went pop, and it would snap out. Now, the people that were on the table were like, this is the most painful thing I have ever had done to me. I was like, but how do you feel?
Right.
And they're like, 75% better in one treatment. And so, so there's a theory to it, right?
Yeah.
So then the question is like, and the system was completely different on how they were looking at things. It wasn't your typical channels necessarily. They were using the typical channels, but the system for diagnostic was very different than how we looked at it in terms of like disease penetration and how it went in. So it was a completely different system, but like she was a whiz. I was like,
because there's a couple papers that theorize that the reason, again, that the people trying to make sense of everything, that the fascial system is what's the reason
where the money is.
Yeah, exactly. And so the winding of the deep and superficial fascia on the needle itself is what's getting these miracles, and that's what the time being is. And so, do you think of that in your mind, or is that not really a thing? Or my next question is going to be, at what point are you taking your acupuncture hat off with a needle and going more MSK? Meaning, like, when would you think, okay, I need to do something at the tissue locally here versus something different? Is there any specific disorders or patient population that would walk in that you would do that for?
It's not a specific diagnosis or a specific patient population. Okay. It's completely how that patient presents, right? Because just like in anything, right? But I think traditional Chinese medicine is really good at this, right? You can have 6 people that come in with reflux, and there's like 6 different diagnostic reasons why people may have reflux, for sure. And you have to treat it the right way, right? So I feel like, everybody's shoulder pain comes in and it's a touch different, right? Yeah. So we kind of have to bend and be a little malleable with that. Do I think that the fascia makes a difference? Yes. I don't stimulate needles a ton, right? Yeah. And I know that there's a lot of people that do. There's tons. I don't know if you guys know, there's like a ton of weird acupuncture theories behind this. Like, are you trying to bring chi into the body, or are you trying to help it escape? Are you closing the hole, opening the hole? Are you lifting? Are you thrusting? Like, are they exhaling when the needle goes in or out? Like, they get real esoteric with it. Yeah. And I'm just like, close the hole or open the hole, or which way are we clocking the needle? I'm good, right? So do I think that makes a difference? Yes, but with a lot of the novice people, and this is why I don't teach it, they wind the tissue up and then they freak out that the needle gets stuck. Yeah, and then they don't know what to do with it. And I was like, okay, well, you can try unwinding it, because what the winding is, I'm gonna use your cork for this. What the winding is it's like 2 steps forward, 1 step back. It's not wind. Okay. So if you want to stimulate something, right, you roll it clockwise, and it's 2 steps forward, 1 step back, 2 steps forward, 1 step back. So it's not getting too much of the fascia wound up in it to get stuck. Okay. It'd be the same thing to sedate. So you can still do that. But for a lot of the patients, like if you feel chi or you feel an ache when I put the needle in, why am I stimulating it more?
Yeah, you've already gotten the outcome.
Right. I've gotten the outcome for what I'm looking for.
Sure.
I mean, sometimes there's patients I want to do it to because you know.
Yeah. Right.
But but I don't.
Very good.
We don't.
And then what about are you ever using needles for specific tissue adaptation? Let's just say like patellar tendinopathy. Would that be something that you're thinking about using needles for? As kind of a thing. Honestly, we do it. It's taught a lot.
Like just I would do it purely create inflammation.
Create the inflammation, so it'll remodel itself. Yeah. I mean, it's the same theory with IASTM, right? We're doing the same thing, but it still goes into that. Like I would do that to create that local response, and then I'm going to go up and release the motor points in the quad and the psoas, right? Maybe facilitate the glutes, and then rehab them.
Sure.
Right. That's the way, in my opinion, it should be done. And this is where I feel like sometimes traditional acupuncture fails, because they're like, okay, bye. Yeah. They needle them and then they send them on their way.
You have made so many headways with medical doctors and being able to get referrals for different things. Like, have you courted that business? Have you just let your results speak for themselves? I'm sure early on you were kind of doing a little bit of networking to make this happen. How did that all transpire?
It was a lot of word of mouth. I mean, I did get on the phone. The musculoskeletal guys are cool with it. Like they get the utility of it, and they don't have an issue working together, especially if they know that, you're integrating PT, or you'll talk to their PT. Right. Because if they've got their PT, right, I'm not stepping on that toe. Like, you want to send acupuncture over to me? Awesome. I'll get on the phone. I'm going to coordinate with your PT, let them know what we're working on from an MSK aspect. And then I'm going to send them on their way and let them rehab them. Right. Because nobody likes when you steal their patients. Right.
Yeah. Right.
Steal their patient. Yeah. Quote. Anyway, the harder sell, which I found was interesting, was originally for fertility. And so now a lot of the big fertility clinics in Chicago have an acupuncturist either on staff, or they have this little door separates out the two clinics, and they park them right next door so that they're acupuncturing women pre and post transfer to improve outcomes.
Right.
So they see the utility of it as well.
What do you think? I mean, I have a subgroup of patients who literally are addicted to acupuncture. I mean, they love it. The people who love acupuncture, why is it?
I think it's the one time that they can go check out, kick back, dark room, relax.
Because it is more your anxiety driven profile. I mean, if you think about the people that
high strung type A, right? And they're doing it for a purpose, right? And it's the same discussion I have to have with my ladies for fertility. And I'm like, look, if you're working 70 hours a week and you're running to yoga and then you're running here to check all the boxes, what are you doing? Mm-hmm. You have no time and space to grow another human being. Right. And your body's going to be like, thanks, but no thanks. Right. So, but no, I think it's nice. And so the joke is I don't mind I'm much like you guys, I am sure. I'm very particular about who I let put their hands on me. Mm-hmm. I like acupuncture from a good person. Right. But at 20 minutes, I'm like, all right, I'm done. Get me off the table. And there's this thought process that your chi cycles every 20 minutes. And it's funny. I feel that. I've literally had patients pull needles out of themselves. I walk in and they're like, here. And I'm like, did you get them all?
Yeah.
I'm doing a needle count. I'm like, make sure they're all there. But But I feel that, and if they leave me too long, it makes me agitated. It's the same sensation I get with like cupping, right? Like if you put a bunch of cups on me, I'll start to get like this, like this full-on sympathetic response. And I was like, shut up. Like, what are you like? Yes, you're completely out of control and it's okay. Like, okay. And then you relax.
Like in our world, when would it be too, we talked about over-treating. So, I mean, like maybe we've manipulated, maybe we've, done some DNS. Like, is now not the good time to be doing that? Or are we okay to do that? Or do you think like, because a lot of us can just bring patients in a different day and say like, this day we're going to do acupuncture. Like,
right.
How can that all fit?
I think it's patient to patient dependent, right? And like, let's not lie, right? I mean, we do look, I mean, I run a cash-based practice now, but like, so I don't really care what I'm all doing in a day because, you're here today and like, let's get your bang for your buck, right? But because I just charge for time. So, but for patients where, we have to keep an eye on reimbursement and services, right? So sometimes that's going to dictate like care for when I used to do that, where I was like, oh, you could see me and do some PT and some acupuncture on the same day, or maybe you can't do the acupuncture. You have to do the acupuncture on the day we're doing soft tissue work. Like, okay, fine. So we'll start to work that system and kind of work that around so that, we're maximizing people's benefits. But man, as long as I'm not over therapying people, I'm like, I'll hit them with everything but the kitchen sink.
Right.
Sure.
And then, I mean, I know who Annie O'Connor is, like, and in her classification, where in that central component where you have central sensitization, you have affective pain, you have
a great book, by the way.
motor on. I know, the best book ever. But like, I mean, does it even matter in your world? Like, are you trying to like classify these patients, or you're just kind of
classify people because there's a whole like I have a woman right now. Right. And she's totally moving into that central sensitization of pain. She doesn't sleep. She's got a newborn, blah, 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 like all this other stuff. And I looked at her and I was like, Band-Aid on a bullet wound, sister. This is what we're doing right now. I was like, you need to sleep. I was like, I can fix nothing until you sleep train your 12-month-old. Time's over. Let that baby cry. They know exactly what's happening. And I'm doing DNS on this baby. She's got no central at all. She's like full on. She's 10 months old. She's army crawling. She won't get up. And I'm like, stimulating her. And she cries. And her mom's like, oh, I know it's terrible. I'm like, stop that. We've had a discussion about this,
Get out in your car. I'll bring your baby to you when I'm done.
I was like, you just go sit outside right now. Let me manipulate your baby. But yeah, I mean, this kid, just like the mom, hypotonia. And I've looked at the mom and I'm like, do you have Ehlers? It's like, you go to try to adjust her. And I was like, there's nothing on you to adjust and you have way too much tissue slack. And I'm like, nope, we're going to needle you. That's all you get.
Right.
Yep.
Yeah.
So then every case is a little bit different, I think is what I hear you saying. So you got to like kind of like
feel them out.
Learn in a dance with somebody and you kind of like see what.
Totally.
And then
which is terrible. It makes me feel like I'm a horrible teacher for this because people are like, but I want a thing. And I was like, I don't have a thing for you. I was like, but I can tell you like what my general system is,
I always think it's interesting to talk about like when you talk about a modality in isolation, which is what they do in research. So if you took somebody with chronic pain, you're like, you know what? I'm not going to change your diet. I'm not going to put you on a walking program. I'm only going to do acupuncture. What would the results be?
It still works.
It still would be really hard.
It still works for a decent amount of people. Right. I mean, yeah, it's definitely better than placebo.
Right.
And it depends on what it is. Like the joke is when you go look at acupuncture research, it's hilarious. It's like, just go needle stomach 36 for whatever, right? In Google Scholar, in PubMed, I don't care. There's like research on how stomach 36 treats everything.
Right.
Right. And so, and it's
same with liver for
right. And it's beyond placebo. Right. So you're like, okay, well, there's something to it.
Right. Yeah. It's like Michael Leahy saying to do the subscapularis ART move for some of the shoulder pain. You know, like
there's so many miracles. We always tell a story like when he had Mike Leahy on, he's like, you could do.
I love subscap ART, by the way.
Yeah. He said you could start your practice doing subscapularis, iliopsoas, and pronator teres. Those three muscles only would be.
And I will tell you, as much as I love Mike Leahy, and I've been working for 22 years, I now dry needle those because my hands can't take it anymore.
You've had three thumb replacements.
My poor fingers. I mean, my thumbs, right? My poor fingers. Yeah. But legitimately, like I will ART a subscap all day. Mm-hmm. I love that. I'll ART a psoas. I'll ART a subscap. I mean, I do myofascial release with movement.
Sure. Right.
So one thing go ahead. Sorry.
Well, I was just going to say, let's move on to that then. Let's say you have someone like me who is, I'm trained in acupuncture. kind of, put it that way. I trained in dry needling. I do a lot of dry needling. Give me advice on how to start incorporating acupuncture. Where do I go from here? What books, what resources,
Excellent.
like where, how do I start actually putting this into practice?
So I will honestly say I like Matt Callison's book. He's got a full-on book right now. But his
What is the last name
original
again?
Callison, Callison.
Do you know what the name of the book is?
It's called, well, I don't know what the name of his book is because I own the Kindled $35 copy of something he has called the Motor Point Index.
Okay.
So the Motor Point Index is really nice. It's on Kindle. Like you could throw it's like upper extremity and
cool.
it has all the muscles listed and you can go beep and it'll take you right to that muscle. But what does it do? Well, it talks to you about the Huato Ji points, right? The points near the spine. It talks to you about the origin, insertion, action, innervation, has a diagram for how you find it, and then it talks about the agonist and the antagonist muscle. Mm-hmm. When you dry needle, typically, right, all you're allowed to do is poke in the dysfunctional muscle. Right. But why shouldn't you poke in the antagonist and then take it back to the dorsal root ganglion and then maybe chain and lock it all the way down? Sure. There's your incorporation for acupuncture. Yeah.
Beautiful.
So that's the stuff I like to do.
Yeah. Beautiful.
So that's give us another book. What are some other good books? Or I mean, like maybe what's a seminar series that you're teaching that would be like a good jump off point for people that are
Sure. So Gary Eastad and I. So Gary, now you guys all have a dry needling code. Yeah, Gary was on that.
Yep.
Yep. So he worked with the MDs and the PTs and the acupuncturists, duking it out in Congress, representing the chiros to be able to get us that code. So it was a big concession, getting that code, huge concession for everybody, but it passed, which is good. So now we have our own code for it. Gary Eastad, Gary studied with Amaro, and then he took, in Ohio, they're a 300-hour state, and he took my whole series with Joe Carter and a bunch of other people that we were teaching with, and Gary and I have befriended each other. So Gary and I have now been teaching with Angel Hong and Andrea D'Amato all around, teaching the 100-hour and the advanced classes for acupuncture. Gary and I started a business. It's called Fusion Care. Why? Because we're fusing things together. Yes. You see what I did there? Yep. Called Fusion Care. And what the whole goal is how are we incorporating acupuncture and dry needling in? And so Gary teaches a lot of the dry needling. He's dip in ortho and dip in rehab. And then he's also got this diplomate in acupuncture. So he's got that. And then I've got the acupuncture. And now we're harvesting out people for classes.
when you're working on a condition and like you're walking in the treatment room and you got some points you're going to use in your mind. Mm-hmm. Like when you were learning, were you like literally kind of cheating? Were you bringing a book in? Were you bringing
all day? Yeah, all day.
And patients don't really mind.
No, because if you're honest with them, and I would just look at people, especially with TCM. I would sit with Chinese acupuncture, moxibustion, and I would sit with them, and I'd be like, my brain only holds so much information, so pause, and I'm like, do you have reflux after you eat late at night? Do you have And I'm trying to get them into a pattern so that I know where to go with them so that then I could stick them. But yeah. I mean, you take muscle testing and function and you take Callison's book and then you're like, I know exactly where I have to go. SFMA. I don't care. However you want to put that together. Right.
But do you think like a starting point is just you need to go back and learn all the points and the meridians? I mean, is that unfortunately, that's like the starting point?
It is the starting point. Yeah. Because the hard part with Callison's book, he gives you the location of the motor points off of traditional acupuncture points. So
you got to know where everything else is.
Bingo. He specifically targeted that because he teaches the acupuncturists dry needling and musculoskeletal acupuncture. So that was his thought process. And I was like, nicely played, Matt Callison.
Way to play with all groups there. That's perfect.
Yeah, he did a nice job with that. But the book it's just nice. It's quick. It's dirty. You can have it because it's on your phone or it's on your device that you're at your job with, right? You're like, I don't remember how to find that motor point. Boop, 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 and it's right there.
Sure.
Yeah.
Sure.
So I do it all the time.
And how much is experience helping you? Like I always tell the story about Dr. Levitt, who, was kind of famous for saying my best treatment will be my last treatment just because of all the years of experience. Yeah. So, I mean, are you growing at an exponential pace right now, or how does that look for in the world?
Yeah. I mean, I don't know if you guys feel this way because I do. the more you study, the less you feel like know. Oh my God, I feel like I'm getting dumber as time's going.
Yeah, I know.
But yeah.
And you actually lose your confidence, ironically, because you're
weird.
Yeah.
You do. It's totally weird. And it's the strangest sensation for me ever. But I have to say that, it makes you start diving deeper into these holes.
Oh gosh, yes.
Right? Of research and information. So
what's your next deep dive?
I do want to get, actually, weirdly, I know one scalp system. There's like 6 that are in there. I want to learn the other ones.
Right.
Yeah.
And then, is the best acupuncture in the world still coming from China? Or is it like there's other hot pockets in the world that are...
Well, France is big, and so is Japan, right? One of those scalp systems, Yamamoto's scalp system. So it's Japanese acupuncture. So Japanese acupuncture is definitely its own thing, right? They don't run off the meridians. Like Kiko Matsumoto is the person that's probably made that the most famous. And it's its own system for sure. So, yeah.
And then besides yourself, if we said, Chris, who are the best acupuncturists in the world? Give us like a couple names of people you still look up to or that like are absolute legends in this field.
Well, props to Dr. John Sunderledge and Richard Yenny. Those two were quiet and behind the scenes for the Wilkes case. I don't know if you guys know that.
No.
Yeah. So, they were helping fund the legal team for that. They fought hard for chiropractors to be able to do acupuncture. And I studied with both of them, Sunderledge more than Yenny for sure. Other people that every year at the CCA, we pull somebody in and I'm like, you're my new favorite person. Because, there's so much to learn.
Because you're so humble, but tell me like your craziest story with acupuncture that like you turned something so insane and like tell us your greatest miracle.
Oh, my greatest miracle. So it was one treatment. I had a guy come in and he had real carpal tunnel. People tell us all the time they have carpal tunnel.
Right.
And they're like, their wrong fingers are numb, And he had real carpal tunnel. And I was doing this test on him and I was like, yeah. And I'm like, no, you have carpal tunnel. You had a repetitive motion job and all this other stuff. I put in PC6 and PC7 to Chi and it, bam, out his fingers. And he was like, ow. And I was like, I hope that was good. And I wasn't like, well, let's keep going, right? Because that could be nerve damage, right? So pulled him out and his carpal tunnel was gone and it stayed gone. I was like, you have to be kidding me. I was like, I am the person. I was like, I'm done. Drop the mic. I'm out. But and then,
I thought she's going to tell us some crazy story of like curing cancer or turning a baby or something like that.
Oh,
and then when she talks about carpal tunnel.
Turning babies. It's funny. I turn more babies with moxibustion, actually.
Really?
Oh, yeah. Yeah. And direct moxa, like where you put the herb right on the skin. I started doing that, just Japanese moxa, a while ago.
On the pinky
Works
toe
way better. On the pinky toe, yes, because everyone thinks it's needling the pinky toe. No, Taylor, it's moxa. That's where the research is. Mm-hmm. So you do moxibustion. I will send people home with Pionex needles and make them go for a walk, though. Right on the little toe.
Yeah.
I did that for one woman, and she told me it was her 4th baby. Baby was transverse. We did all this work for her. And then she's like, I'm not going out with a C-section with my last one. Right. So I sent her home with Pionex. She went out for a walk. She was like, oh, Chris, she's like, that baby turned quickly and violently. She was like, lost control of her bowel and barfed at the same time.
Oh, God.
And then she went into labor.
Oh, geez.
But the baby was head down. Yeah. So weird stories like that. But it's moxa. And what I did find out from studying with the Japanese moxa people is that you can moxa spleen 6 on a pregnant woman. You can't needle it, right? But you can moxa it because they become so blood deficient. And so, yeah.
Okay. So the next question is you're not allowed to answer with it depends. So your average case that you see, let's just say, what does the treatment plan look like? Are you actually discharging these patients at some point? Or a lot of these people are so difficult that you're like, they're kind of, I hate to use the term maintenance, but they're kind of like a maintenance type thing. What is that? If you saw a new patient today, when are you telling them to report back to you?
So musculoskeletal, I usually have them come back somewhere around 5 to 7 days. So it's usually about a week because I'm sending them home with stuff, whether it's rehab exercises, McKenzie therapy, whatever, breathing, DNS, something, right? I'm sending them home with something. My tough cases are my fertility cases, right? Because they ain't done till they have a baby. Mm-hmm. So that could be years. I have people on 6 and 7 cycles of IVF.
Right.
So those are rough. And it's, it's gut wrenching. I've had people end up with 16, 17 week fetal demise.
Right.
But no, the MSK people, my goal is 4 to 6 visits and you're out. I tell people all the time, I love you, but I don't want to see you again.
Yeah, some of these difficult cases, you really don't want to see them. Yeah. What about, there's a little bit of a rub now, with the functional medicine world and the Chinese herbal world.
Yeah.
Are you 100% bought into the Chinese herbal world? Are you we just had Tohtz Kazarian recently on our.
I love him.
Oh, he's a stud.
He's a genius.
He's the best. But
I reference his notes all the time.
That's coming. That'll be coming.
I'm excited to hear that. He's such a humble man.
Mm-hmm. Yeah, he really is. But so what do you, how do you reckon, you have this thought over here and then you have I feel like functional medicine is changing by the hour.
So
literally.
fast. I mean, all the way from when I got certified to the protocols for how we're managing hypercholesterolemia and stuff like that. It's changing, what they're recommending, doses, herbs, everything. I don't have problems with Chinese herbs. The problem with Chinese herbs is sourcing. Right. There's a high level of contamination in a lot of the herbs, and you have to be careful where they're grown and where they're harvested because, the Prop 75 stuff out in California and heavy metals is a real thing. So I think that could be problematic for sure. So we have to make sure that the quality of the herbs are there. But I went back to Chinese medicine school, right, to study TCM for 2 reasons. A, to make sure that I could practice acupuncture somewhere else. But I went back for an MSOM, which was Oriental medicine, because I did placenta encapsulation for my postpartum ladies. And I was like, what if I could take Zihe, which is placenta, and customize their placentas into a full herbal formula. This was the mad scientist in me. I know. I was so this was what I went back for. And so I went through 3/4 of my herbal education, but I had to stop going and I dropped back to MSAC because my clinic was 30% down in revenue and I had people employed. Right. And I was I gotta go back. Right. So that's what happened. I love the herbs. When I was in China, there's a bunch of herbs in the compendium that we learn about that aren't available here. And I didn't know why. And so I'm asking them, I'm what's that? And they'd tell me, I'm what does it treat? Cancer, 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 cancer. Why won't the FDA let the cancer herbs in?
Yeah. Well,
that's for another podcast.
And so that's why I was oh, there's something to it, right? And, if you really look at the materia medica for the herbs, you see the research that's gone behind it. And it's antihypertensive, antidiuretic, blah, blah, blah. So it'll tell you what the herbs are actually doing. A lot of the herbs that Tohtz uses in his formula, they have crossovers in TCM.
Right. If you had to visualize a pie chart right now, and this pie chart was representing your results, mm-hmm. What of the pie chart would make up your needling versus your nutritional, herbal advice, functional medicine advice? Your results are being driven more by, what would the pie chart look like?
So that depends on where I was in practice, right? So as I've acquired more knowledge for functional medicine, it's taken over a bigger piece of the pie chart for sure.
That's what everybody says. Yeah.
Yeah. So, that's moving into 60 to 70%.
Right.
Because even my MSK cases, they're getting nutrition put on them.
Sure.
Because I don't want to see them again.
Right.
So if we can get the inflammation driven down, then the better off they are. But yeah, I would say it's probably between acupuncture and chiropractic. It's pretty equally split.
Right.
Beautiful.
Okay.
Great job. I feel we covered a lot of shit there, a lot.
So. And it always, I knew this would happen. It makes me I have never closed the book on acupuncture. I know there's something there. I just need the right person to inspire me again about what exactly it means in our world. Because I think our listeners probably will never do exactly what you're doing, right. But if they can be motivated to take an acupuncture course through you, or you're doing you're everywhere. So if they can catch up with Chris Tohtz, I think that would be an amazing thing, because I think in a world that can be a little different and weird, you're a voice of reason that really just makes us seem so normal. I try to make the
weird reasonable.
Yes, yeah. Right. That's what a compliment. Yeah.
That'd be a huge compliment.
Yeah, it really
and hey, way to join the hippie clan.
Isn't that funny how that goes? My classmates would be so proud of me right now.
I am deeply proud of you. It's hard to let go of that.
Oh gosh, yeah. Well, I think functional medicine is the future of medicine. Functional
medicine is so amazing. Can I tell you, I go to a lot of Tohtz classes online, of course. But like the man blows my mind.
Yeah. Oh yeah. Superstar.
Yeah.
He's amazing. His episode was great too. So if you haven't listened to that one, go back and listen to it because it'll be out by the time this one comes out. So that's the best part. So Chris, what a pleasure, man! Oh, it was so awesome. Yeah, let's go get some food and hang out. Yeah, great to meet you. Great to know you. Start open up those acupuncture books.
Don't close the book on that just yet.
Don't close the book on it. Yeah, keep up your studies.
Yeah.
Like there's always more to learn.
I love it. All right, guys, have a great day and good luck with patients. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.